Element 3, Health and Safety Management Systems to Organizing. Outline the health and safety roles and responsibilities directors and senior managers. To make sure that the company is complying with the moral and legal requirements for health and safety. Ensure effective implementation of health and safety policy within the company. To make employees understand that the management is not only responsible but also accountable for health and safety matters. To ensure that the effective OSH training plans are in place for all employees. To ensure that the company is giving health and safety is one of the top priority. To ensure that the workers may feel at ease in raising the health and safety issues to them and an effective method of employees consultation is in place. Leads by example by showing commitment by getting involved in all OSH campaigns, events. Carry out regular H&S meetings so that the issues can be addressed timely manner. Involve and to be a part of Health and Safety Committee to provide the platform to resolve health and safety issues. To carry out safety tours to meet workers and compare the theory with the reality. To ensure that organization's motivation activities are there in place. Supervisors. To implement the safe system of work, for example works to be carried out as per approved system work. To provide escorts to the visitors coming to the site. To take reasonable care for all OSH matters of the employees working under his supervision. To make sure that the employees with special risks like young workers, disabled and pregnant ladies. Conduct regular toolbox talks and to communicate all the health and safety issues to the workers. To take initiatives in carrying out the jobs safely in consultation with the workers. To be a part of team conducting risk assessments so that his knowledge and experience will be helpful in foreseeing the risks associated with the activities. To take disciplinary actions for all the breach of health and safety issues by the workers. To assist in solving issues regarding the safety of equipment at workplace. Issue and ensure all personal protective equipment are used while at work and are maintained. C. Persons with primary health and safety functions, e.g. Health and Safety Officer. To advise on health and safety issues implementation to the site management, supervisors and health and safety manager. To play his role in implementing health and safety policy, procedures within the company. To carry out induction trainings for the workers, visitors coming at the workplace. To carry out daily inspection of plant and premises in order to highlight the issues that require urgent attention and can lead to accidents at workplace. To keep record of accident, incident and near miss and other health and safety records. To prepare health and safety reports for the company on monthly, weekly basis according to the requirement. To monitor the welfare facilities provided to the employees and provide recommendations for improvement. To notify company and legal, regulatory authorities about the accidents, dangerous occurrences in the workplace. To carry out safety surveys and safety tours in coordination with health and safety manager and top management. To notify the supervisors about any changes in the applicable health and safety legislation so that the supervisor can implement the same within his group of employees. To carry out health and safety audits for effective implementation of health and safety management system. To carry out health and safety trainings. Identify precautions that could be taken to help to ensure the health and safety of visitors to a workplace. Identify visitors by signing in and out. Provision of badges. Provide escorts to supervise visitors throughout the site. Restrict access to areas where higher risk activities take place. Provide training-related fire emergency procedure. Provide suitable PPE to the visitors while they are inside the site visit. Provide different reflective jacket to identify visitors clearly on site. Identify a range of methods that an employer can use to provide health and safety information directly to individual workers. Notice boards. Team briefings. Training sessions, including induction training. Toolbox talks. Newsletter. Safety campaign. posters, competition and signs. One-to-one briefing such as in appraisal session. Outline why it is important that all persons are aware of their roles and responsibilities for health and safety in an organization. By knowing their responsibilities is the right education and will preserve the employee free from ill health. The awareness shall protect themselves and those around them from harm. The employees shall cooperate with employer, including reporting any situation that present imminent risk. The employee shall actively participate and exercise all health and safety related matters and committees. The employee shall work towards and achieve the health and safety standards set by the employer. The employee to be familiar with occupational health and safety legislation compliance while at work. It will ensure them to keep the workplace and the equipments are well maintained without risk. To avoid any misuse of workplace welfare facilities provided. Two organizations share the same work site. Outline how the organizations could work together to help ensure the workplace is safe and healthy. The organization should take as far as reasonably practicable to ensure competency of its employees and is satisfied with the works that are being carried out properly. Ensure there is full cooperation in order to discharge their duties under good practice or where appropriate relevant statutory provisions. Proper risk assessment to be conducted and provision for serious and imminent danger. All the contractors should coordinate and cooperate where they have common workplace to satisfy themselves that arrangements are adequate. Organization should ensure that all relevant workers and in particular, competent workers appointed are aware and fully take part. To ensure the contractors must take reasonable steps to inform other employers concerned of risks to their workers' health or safety that may arise out of their scope of work. Organize and ensure that required first aid materials and first aid are in place. All the workers are trained for emergency procedure and hazardous present at site. Ensure that quality of supervision is in place and the works which are carried out are as per the allowed system of work. 6. Give the meaning of the term perception. The meaning of the term perception is the way that a person views a situation, or the ability to see, hear, or become aware of something through the senses. Identify ways in which workers' perceptions of hazards in the workplace might be improved. Providing appropriate information to workers. By providing training, instruction. By conducting drills, disciplinary actions. By providing incentives. A serious accident has occurred. During the investigation it is found that an inspection of the work site had taken place before the accident. Outline possible reasons why the inspection did not lead to an unsafe situation being corrected. The possible reasons are: inspection was done by an incompetent person. Inspection did not identify the hazards which could have led to the incident. Inspection must have done using an outdated checklist. The result of the inspection was not communicated to the management. Lack of management commitment to take necessary action to implement the control measures identified in the inspection. Poor employees' health and safety culture towards the identified control measures. The control measures recommended are not enough to eliminate the hazards. Poor health and safety culture within the organization. 9. Outline ways in which the health and safety culture of an organization might be improved. Establishing and implementing a good health and safety policy. Securing the commitment of management and ensuring that managers lead by example. Involving and consulting with employees on matters affecting their health and safety. Providing effective supervision and training. Providing a pleasant working environment with good welfare facilities. Procedure and standards for all aspects of critical work and mechanisms for reviewing. Effective monitoring systems to check the implementation of the procedure and standards. Incident investigation and the effective use of information drawn from such investigations. Adequate and effective supervision with the authority to remedy deficiencies when found. 10. Outline ways in which an organization could encourage workers to be involved in setting and maintaining high standards of health and safety. Good levels of supervision, health and safety information and training which may affect the health and safety awareness and therefore culture. No blame culture for reporting incidents. Good levels of communication, cooperation and control, consultation and involvement of the workforce in health and safety matters. Management commitment to health and safety, including formal aspects such as health and safety policy, organizational structure and job descriptions. Clarification of responsibilities. Adequate resources, budget, people and facilities, made available for the effective management of health and safety. Compliance with relevant health and safety law and the safety rules and procedures of the organization. Involving workers in health and safety decisions, by consultation, team meetings, for example. 11. An organization needs to review its provision of health and safety training for its workers. A. Identify factors that should be considered when developing an extensive program of health and safety training. Type and function of the organization. Hazard and risk profile of the organization, for example if woodworking machinery is used, training in its safe use should be provided. Accident history of the organization, which may indicate areas where awareness is lacking or training is needed. Any statutory training requirements, for example for first aiders. Level of training previously provided, together with the details of which employees have been trained and when. The type of chemicals or any other kind of hazardous chemicals in use. Need for a third-party training if required. Legal requirements as well as statutory obligations in place. B. Identify measures that might be used to assess the effectiveness of health and safety training. Reduction in accident and absence rates. Increased awareness of the topic covered, for example an increased number of worker comments, concerns highlighted. Improved compliance to safe systems of work. Post-training evaluation by trainers, the trainees themselves and their supervisors. Levels of compliance with laid-down procedures, for example wearing PPE. The results of attitude surveys. Number of quality suggestion made, concerns raised by employees with respect to health and safety. C. Identify checks that could be made to help to assess whether a person is competent. Knowledge. Ability. Training. Experience. Fitness records. Legislation awareness. Knowledge about health and safety compliance that may required for work. Awareness about safe system of work. D. Give reasons why it is important for an employer to keep a record of the training provided to each worker. It is important to keep records of any training given, not only to record who has been trained but also to update and show progress against the training plan. Training records should detail the level of competence achieved, the date of the training and highlight when any refresher training is required. These records may be used to demonstrate to regulators that adequate training was provided. To prove in a civil claim or an accident investigation that an employee had received training. To provide it to clients to confirm competency of the staffs. 12. Identify factors that could have contributed to the deterioration of the health and safety culture within the organization. Lack of leadership from management. Presence of a blame culture. Lack of management commitment to safety, for example saying one thing and doing another. Health and safety receiving lower priority than other business issues. Organizational changes, frequent or poorly communicated change can result in uncertainty. High staff turnover rates. Lack of resources, for example too few workers due to downsizing. Lack of worker consultation. Interpersonal issues, for example peer group pressure, bullying or harassment. Poor management systems and procedures. External influences, for example economic climate resulting in difficult operating conditions. 13. Identify how induction training programs for new workers can help to reduce the number of accidents in the workplace. Better understanding and involvement raises all workers' job satisfaction, resulting in reduced accidents in workplace. Training would benefit the new workers to understand the system of work and controls needed to reduce risk. Training will help the new workers to understand the welfare arrangements aids health, safety and hygiene. Induction training allows workers to reach experienced workers' standard more quickly. Increases the flexibility of staff. Induction training will help them to understand and evacuate the premises in case of emergencies. Will help them to comply with health and safety requirements. Induction training helps the new workers to understand the legislation requirements and to avoid any legal or court fines. Will help to increase the morale of the workforce. 14. Identify the barriers to effective verbal communication. Language barrier may exist. Jargon may not be understood. Strong accent or dialect may interfere. Background noise may interfere. Recipient may have poor hearing. Message may be ambiguous. Recipient may miss information. Recipient may forget information. No written record as proof. Poor transmission quality if by telephone or PA system. 15. A. Identify 4 types of health and safety information that could be displayed on a board within a workplace. Emergency procedures. Employer's liability insurance. Health and safety policy. Safety representatives. First aiders. Minutes of safety committee meeting. First aid information. Accident statistics. Specific site hazards and controls. Identify how the effectiveness of notice boards as a method of communicating health and safety information can be increased. Notice board information must be up to date and maintained in legitimate condition. Notice board information should be written in appropriate language where the employees can read and understand. Where possible, provide pictures to describe the information which would make easy to understand the issues correctly. Information should be bold, clear and concise and easy to read and understand. Provide workplace incident, accident information with pictures. Training schedule, both internal and external. 16. A. Identify 2 main purposes of first aid treatment. Preserve life. Prevent deterioration. Promote recovery. Outline factors to be considered when carrying out an assessment of first aid. Requirements in workplace. General risk level of the workplace. Hazards present in the workplace. Accident history. Specific procedures required, for example some toxic materials have specific antidotes or first aid protocols. Presence of vulnerable persons. Number of workers in the workplace. Work patterns and shift systems of workers. Geographic location of the workplace. Spread of the workplace.